Hi everyone, I'm Dr. Faisel Syed,
And I'm Dr. Dan McCarter.
and you're listening to Faisel Friends, where we believe access to primary care is a right, not a privilege. Today, we're talking to Dr. Roberto Ochoa, ChenMed's National Director of Hematology, Oncology, and Palliative Care, about value-based oncology, transformative cancer care. Let's dive right in.
Hey guys.
Dr. Ochoa, it's good to see you.
Likewise, how are you?
I'm doing really well. Dr. Dan, good to see you too.
Yeah, good seeing you, Faisal, and good seeing you, Roberta.
Hi, Dan.
Well, we're so happy to have you on the podcast today.
Oh, please, it's my honor to be here.
We've known each other for years, and this is just a privilege to be able to have you here. I mean, I'm really happy. First of all, I don't understand why you're looking younger and I'm looking older. First of all, can we start off there? What are you doing?
That's easy. You need glasses, my friend.
See that a hemonc doctor answering a question that only an ophthalmologist could answer. I don't even know if there's an ophthalmologist who could have answered that question any better.
I am smart enough to know when somebody needs glasses. That's all.
So, Roberto, we've known each other for years, and now we have an entire team of specialists who are integrated within the our primary care model, connected by GLIP. They text each other. The doctors and the specialists work really well with each other. But even before all of that, you were our go-to person for so many issues related to hematology and oncology for years. So before we get into that, I'd like to talk about, your story. I know a little bit about your story, but I'd like for you to share your story about why you pursued medicine, and then why did you end up choosing hematology oncology? And then from there, I'd like to talk about your journey to ChenMed, and then your thoughts with how things have evolved with how specialists are interacting with our primary care doctors and vice versa.
Great. So, well, as you all know, I'm originally from Venezuela, from South America, and I watched growing up my dad practice as an internist back then. He still practices to this day, and the way he practices is very much in line with our model. I mean, it was countless the amount of times that I went with him to visit patients' homes, to stop by the ER or the hospital on a weekend to see patients, or to be with him when he received phone calls, from all sorts of people all the time. So that's how what I saw growing up. That's to me, that's how you practice medicine. You're available to your patients at all times, and you do what you have to do. So and so I learned that that's pretty much what a doctor does. From my dad, and I at some point I decided, that's what I want to do. So that's why I joined, and joined, started medical school back in Venezuela. So the oncology part is actually, I always wanted to be a cardiologist. And at some point in time, actually, I worked for a bunch of months in a cardiac cath lab. And I was sure that I was going to do that. But actually, what, you know, really didn't like about that is just cardiologists are fairly narrow on the kind of what they do is all about, cardiac catheterization, echoes, and that's pretty much it. And the extent and the complexity of the diseases that they manage was not really something that was in tune with what I was looking for. And then I met these oncologists back home, who I always like to mention his name, Sunil Daryanani. And I always make fun of him that it's his fault that I'm an oncologist, right? And during my training in medical school, the exposure to oncology was very limited. We didn't have a hemonc rotation per se. You would see lung cancer cases in your pulmonology rotation, or GI cancers when you were doing your GI rotation and so forth, but no oncology specifically, no specific rotations on oncology. Actually, I don't recall even talking to one. So when I did internal medicine back home, before moving to the United States, and I had that kind of um, I don't know, that uh, concern or I don't know, interest of understanding what oncology was about. And then I met Dr. Darjanani in the hospital I was training in, and I asked him whether I could join him in his clinic, and he invited me in. And I will never forget this patient of his with pancreatic cancer, unfortunately very advanced. She was in a lot of pain. She was very depressed, and she was not from Caracas, from the capital, which is where I was at, where I lived. Um, and one of her main goals was actually to have enough, functional capacity and to be with the pain to be as controlled as possible for her to travel to her own hometown in Margarita, which is an island in north part of Venezuela, to spend time with her family. That's what she wanted to do. So Sunila treated her with what was then a basic, the standard treatment for that, which is a drug called Gemsar. Um, and it was amazing to see her over a few weeks feel better. The pain started to get much better. Her depression actually improved to the point that actually she hopped on a plane about 4 months later, went to Margarita, spent time with her family, and then passed away. So, and what I will never forget is her family coming back about 2 or 3 months later to thank us for all the treatment that she received, and because we were able to help her get to a point where she spent time with her family. So to me, that's my aha moment. It's like, this is what I want to do. And that's when I learned, you know we're here to really help people feel better. If we can cure the cancers, even better. But if we can't, at the very least, we can make them feel better and spend time with their families. So here I am. I moved to the States. I did internal medicine at the University of Miami, as you know, and then Hemonc at University of Miami as well, at Sylvester Cancer Center. And I joined ChenMed right after. And I've been here for 10 years, and I can't be happier. So that's pretty much my story.
Wow, what you spoke about with the goal, of course, you want to heal whenever possible, but if you can't heal, to ease their suffering. No one wants to suffer, and no doctor wants to see a patient suffer. I mean, before like the modern era with medicine, the primary function of the physician was to ease suffering.
Absolutely. It's always been. When you think about it, it's always been. And in my opinion, somewhere along the way, we forgot about that. We think that it's all about trying to cure things and to do things to cure the problem, regardless of the price or the cost in terms of the harm that you may be getting with all those treatments and so forth. And forgetting that very important piece that we're here to help people, feel better above all.
Yeah, I feel like oftentimes in medicine, it's not, and I feel like most of the time it's unbeknownst to the doctor. It's that inherent desire to help in any way, that we got to do something to help someone, and we may be causing harm with that desire to just do something, to order something, or to prescribe something,
Right.
and it could end up causing harm if we just listen to the patient. Like that story with your patient, she was in the final weeks or months of her life, and she had one desire: to make this difficult journey to go be with her family.
Right. You're absolutely right. And I think, if you just listen, you talk to patients, you understand exactly what they want to accomplish, then you can really tailor the stuff that you have available to help them to what they want. You know, Sometimes that wish is really to try to live as long as you can. Then that's okay. We have stuff for that. But if you're more interested in actually just spending more quality time with your family, then there's solutions for that as well. And neither is good or bad. It's just options. It depends on what you're trying to accomplish.
Dr. Dan, we talk often about the sacred nature of the doctor patient relationship. And as I'm hearing Dr. Ochoa speak about the doctor patient relationship, it's, there's different types of relationships. And the relationship that we're talking about between a doctor and the patient, we like to call it is a sacred relationship. It's a very intimate relationship. There's a bilateral communication. It's not just the desires of one person or the other, or just, one person's thoughts versus, it's them coming together and working together in the best interest of the patient. And we've gotten away from that. For me, in my mind, I know there are many reasons why that has happened. But for sure, one of the main ones, I believe it's because of the transactional nature that the doctor patient relationship has become over the last couple decades, don't you think?